In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 81. Which of the following displays the proper use of the Zimmer frame? Option A, using a 1-point gate. Option B, using a 2-point gate. Option C, using a 3-point gate. Option D, using a 4-point gate. The correct answer is C. Question 82. When would it be beneficial to use a wound care plan? Option A, on initial assessment of wound. Option B, after surgery. Option C, during wound infection, dehiscence, or evisceration. Option D, all of above. The correct answer is D. Question 83. The human body is made up of approximately what proportion of water? Option A, 50%. Option B, 60%. Option C, 70%. Option D, 80%. The correct answer is B. Question 84. Concentration of electrolytes within the body vary depending on the compartment within which they are contained. Extracellular fluid has a high concentration of which of the following? Option A, potassium. Option B, chloride. Option C, sodium. Option D, magnesium. The correct answer is C. Question 85. A patient had just undergone lumbar laminectomy. What is the best nursing intervention? Option A, move the body as a unit. Option B, move one body part at a time. Option C, move the head first and the feet last. Option D, never move the patient at all. The correct answer is A. Question 86. What is nocturia? Option A, urinary frequency. Option B, urination at night. Option C, poor urine output. Option D, non-passage of urine. The correct answer is B. Question 87. It is important that patients are effectively fasted prior to surgery in order to. Option A, reduces the risk of vomiting. Option B, reduces the risk of reflux and inhalation of gastric contents. Option C, prevents vomiting and chest infections. Option D, prevents the patient gagging. The correct answer is B. Question 88. A client with a right arm cast for fractured humerus states, I haven't been able to straighten the fingers on my right hand since this morning. What action should the nurse take? Option A, assess neurovascular status to the hand. Option B, ask the client to massage the fingers. Option C, encourage the client to take the prescribed analgesic. Option D, elevate the right arm on a pillow to reduce edema. The correct answer is A. Question 89. The use of an alcohol-based hand rubs for decontamination of hands before and after. Direct patient contact and clinical care is recommended when Option A. Hands are visibly soiled. Option B. Caring for patients with vomiting or diarrheal illness, regardless of whether or not gloves have been worn. Option C. Immediately after contact with body fluids, mucous membranes, and non-intact skin. The correct answer is C. Question 90. What are the signs and symptoms of shock during early stage 1 to 3? Option A. Hypoxemia. Option B. Tachycardia and hyperventilation. Option C. Hypotension. Option D. All of the above. The correct answer is D. Question 91. In the context of assessing risks prior to moving and handling, what does TILE stand for? Option A. Tasked Individual Lift Environment. Option B. Tasked Intervene Load Environment. Option C. Task Intervene Load Equipment. Option D. Task Individual Load Environment. The correct answer is D. Question 92. For which of the following modes of transmission is good hand hygiene a key preventative measure? Option A. Airborne. Option B. Direct and indirect contact. Option C. Droplet. Option D. All of the above. The correct answer is D. Question 93. What medications would most likely increase the risk for fall? Option A. Loop diuretic. Option B. Hypnotics. Option C. Beta blockers. Option D. NSAIDs. The correct answer is B. Question 94. How many phases of carotid cough sounds are there? Option A. 3. Option B. 4. Option C. 5. Option D. 6. The correct answer is C. Question 95. You can delegate medication administration to a student if Option A. The student was assessed as competent. Option B. Only under close, direct supervision. Option C. The patient has only oral medication. The correct answer is B. Question 96. If a patient has been assessed as lacking capacity to make their own decisions, what government legislation or act should be referred to? Option A. Health and Social Care Act 2012. Option B. Mental Capacity Act 2005. Option C. Carers Equal Opportunities Act 2004. Option D. All of the above. The correct answer is B. Question 97. If a patient is prescribed nebulizers, what is the minimum flow rate in liters per minute required? Option A 2 to 4, Option B 4 to 6, Option C 6 to 8, Option D 8 to 10. The correct answer is C. Question 98. Why are physiological scoring systems or early warning scoring systems used in clinical practice? Option A. They help the nursing staff to accurately predict patient dependency on a shift-by-shift basis. Option B. The system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk. Option C. These scoring systems are carried out as part of a national audit, so we know how sick patients are in the United Kingdom. Option D. They enable nurses to call for assistance from the outreach team or the doctors via an electronic communication system. The correct answer is B. Question 99. When you tell a third-year student under your care to dispense medication to your patient, what will you assess? Option A, whether SC, he is able to give medicine. Option B, whether SC, he is under your same employment. Option C, his or her competence and skills. Option D, supervise directly. The correct answer is C. Question 100. You are caring for a patient who has had a recent head injury and you have been asked to carry out neurological observations every 15 minutes. You assess and find that his pupils are unequal and one is not reactive to light. You are no longer able to rouse him. What are your actions? Option A, continue with your neurological assessment. Calculate your Glasgow Coma Scale GCS and document clearly. Option B, this is a medical emergency. Basic airway, breathing and circulation should be attended to urgently and senior help should be sought. Option C, refer to the neurology team. Option D, break down the patient's Glasgow Coma Scale as follows. Best verbal response V equals 20. Best motor response M equals 20. And eye opening E equals XX. Use this when you hand over. The correct answer is B.